So, next lecture in our coronary heart disease module is understanding the pathophysiology of coronary heart disease and classification. So, this is a little complex lecture involving the basic science as well as the physiology and subsequently physiology turning into a disease process. So, we are world number 1 in coronary heart disease, we already told you, because of our lifestyle change. And there are certain terms you have to understand. When we say coronary heart disease, we have saying that the patient has got occlusion. The patient chest pain is because of the occlusion in the coronary artery. Some people also call this a ischemic heart disease. So, the ischemic heart disease is a broader terminology. Whereas, when you say coronary heart disease, you make sure that the ischemia to the myocardium is due to coronary artery obstruction. When you say ischemic heart disease, sometimes ischemia can happen without coronary heart disease, especially when the demand is more and your supply is less. Even in the absence of coronary artery occlusion, you can have ischemia. So, ischemic heart disease is a broader terminology, whereas a coronary heart disease is a specific ischemia due to occlusion of the coronary arteries, be it in the macro vessels or in the micro vessels. So, when you say coronary artery heart disease, it means coronary heart disease with the involvement of the myocardium. So, already the myocardium is damaged because of either myocardial infarction or it has already gone for LV dysfunction. So, when you have a myocardial involvement in the form of already having a old myocardial infarction or LV dysfunction, you must call that as coronary artery heart disease. Here only arteries are obstructed, here the heart is involved. I will come to the definition of cardiovascular disease subsequently. Then you must also know what is the difference between atherosclerosis and arteriosclerosis. Atherosclerosis is a disease of intima, which is the one which is we are going to see in detail about atherosclerosis in this lecture. Here it is because the vessels involved are the medium, which I told you, the conduit vessels like coronary vessels, cerebral vessels, the renal vessels, mesenteric vessels. So, these are all called conduit vessels because they are medium sized. They have a significant smooth muscle cell in their media and also it may be a micro-sized vessels. So, whenever atherosclerosis is the problem of deposition of lipids in the subintimal space, which transforms into atheroma, plaque ruptures, thrombus produces acute coronary syndrome or acute cerebrovascular accident. Whereas, when we say arteriosclerosis, we mean the